Welcome to Johns Hopkins Medicine online webinar series. Today, leading experts from the Johns Hopkins Department of Radiology MRI clinical program will discuss details and expectations of this 6-month program. Before we get started, we'd like to share a few tips to help you get the most out of this experience. The first part of our program will include an informative presentation by our presenters, followed by our live Q&A session. To submit a question, please type into the Q&A box and click send. Your questions will be seen by others watching this presentation, so please note, if you do not want your name attached to your question, please check send anonymously. We will do our best to answer all questions we receive during the session. Alternatively, you can email us questions and feedback to hopkinsseminars@jhmi.edu. Please note this program is being recorded. We would greatly appreciate receiving your feedback and ask that you complete our survey. A pop-up window will appear at the end of our program with the survey. And now we would like to begin our presentation.
Welcome to the MRI program webinar. I'm Krista Stewart, the MRI Clinical and Operations Manager. With me are the MRI program co-directors Eileen Day and Nikki Seward, and MRI technologist and recent MRI program graduate Jasmine Davis. During this webinar, we're going to review MRI at a glance, MRI at Johns Hopkins, the MRI program at Johns Hopkins and the application requirements, what to expect as an MRI intern from the MRI educators and recent graduate, life in Baltimore, and post-program opportunities. MRI stands for magnetic resonance imaging, and it is a diagnostic technique that uses a magnetic field and radio frequency waves to produce pictures of structures inside the body. It was developed in the 1970s and is considered a newer modality compared to X-ray and CT. Due to this, the technology continues to evolve with shorter and faster scans. You never stop learning an MRI, especially at Johns Hopkins. Johns Hopkins has inpatient and outpatient locations with 22 MRI scanners that serve around 77,000 MRI patients each year. At Johns Hopkins, we have cutting-edge equipment and technology that you wouldn't see anywhere else. For instance, we have an MRI scanner in the OR. Our senior leadership are fully supportive of our extensive MRI safety policies and procedures that ensure to keep our staff and patients safe. This is a map of all the potential clinical rotations that an MRI intern could go to.
Hi, my name is Eileen Day. I'm the MRI technical educator at the Johns Hopkins Hospital and the co-director of the MRI program. The MRI program at the Johns Hopkins Hospital started over 25 years ago. It originally started as a very basic on-the-job training in the early 2000s, and it has advanced throughout the years as an ASRT and ARRT certified post-primary program. Our class sizes are small. They're averaging 5 to 8 students. This number varies each year, for we base our class sizes on staff vacancy rates. During our program, you will receive approximately 1,000 hours of classroom and clinical training. By the end of our program, you will have received the appropriate amount of classroom and clinical experience needed to sit for your ARRT MRI certification. Since our MRI program at the Johns Hopkins Hospital has started, we have had a 99% ARRT MRI certified pass rate. We are extremely proud of our program and all of the amazing MRI techs that have come through. A lot of our MRI technologists have gone through advanced senior roles, which Krista will talk about in the upcoming slides. Our MRI program at Johns Hopkins is a 6-month program and typically runs each year from February to August. This 6-month program is a full-time, Monday through Friday, 40 hours a week commitment, and it has no weekends and no overnight shifts. A huge benefit of our program is that you are a paid full-time employee and you qualify for all employee benefits. That includes health insurance, dental, vision, retirement, paid time off, short disability, and so much more. There is no tuition for this program. Because you are a full-time employee during our program, and we invest an incredible amount of time and effort to support you, and we make sure that we graduate really well-rounded and competent technologists, there is a 2-year work commitment that is required if accepted into our program. This commitment starts on your first day after graduating the program. There is an extensive MRI program application process. So if you're interested, please listen very carefully. The Johns Hopkins Hospital MRI program is currently an American registered it's an ARRT post-primary pathway. This means there are a few options, so please listen carefully. So you can be ARRT certified in radiography, radiation therapy, ultrasound, or nuclear medicine. You can also have your nuclear medicine certification through the Nuclear Medicine Technology Certification Board. You can also be certified as a registered diagnostic medical sonographer, a registered vascular sonographer, a registered cardiac sonographer, and a registered musculoskeletal sonographer, all through the American Registry for Diagnostic Medical Sonography. That's all a big mouthful, so please make sure you read that very carefully. And I also recommend making sure that you review the ARRT post-primary pathway online just to make sure that it's all up to date and nothing has changed. They do make updates and changes, so please make sure that you review their website often. If you are currently in any of these programs now as a student, that is okay. As long as you are done with your program and then you have taken and passed your boards by the start of our program, ideally, we would like it by January because of our hiring process. But again, if you are currently a student, that is still fine. You just have to take and pass your boards by the start of our program. Some other requirements is that you have to be a U.S. citizen, or you have to at least have your green card. And then you have to be at least 18 years of age. If you meet all of the ARRT's post-primary requirements and you can go online to our website, there are a few other application needs that we would need, which is a cover letter, a resume, some transcripts if you recently graduated in the past 5 years. That could either be from a medical imaging program or a previous college. And then we also need 2 mandatory references that we would need. Once all of that information is submitted and received, we'll set up a 30-minute in-person interview about 2 to 4 weeks after the application deadline has passed. Then once all interviews are completed, acceptance decisions and notifications are then made 2 to 3 weeks later after this. All applicants will be notified of acceptance or denials by mid to late November.
Hello, everyone. My name is Nikki Seward. I am the MRI Technical Imaging Specialist for the Johns Hopkins Hospital and the co-director of the MRI program. If you are accepted into the program, your first day as an MRI intern will be in February, and your graduation day will be in August of the same year. The program is 40 hours per week, Monday through Friday. The standard hours are 6:30 a.m. to 3 p.m. And throughout the 6-month program, there is only 1 to 2 required evening rotations. The hours are either 11 a.m. to 7:30 p.m. or 12 to 8:30 p.m. The entire first week is dedicated to orienting you to the department and to MRI. It is during this time that you will learn so much of the MRI basics. On week 2, you start your clinical rotation assignments and classes. Classes are split into 2 half days followed by clinical time. An example schedule looks like this. On Monday and Tuesday, you work 6:30 a.m. to 3 p.m. in your assigned clinical area. Wednesday at 6:30 a.m., we start MRI physics class, and when class is over, you report to your assigned clinical area until 3 p.m. Thursday at 6:30 a.m. is MRI anatomy, protocols, and procedures class. Once this is over, you're going to report to your clinical area. Friday is a full clinical day. After you take your final exams for these classes in May and June, there will be a few days of scheduled reviews and additional lectures, such as advanced MRI safety. This means starting in July, you have the opportunity to have 5 full days in the clinical environment. This program is designed to provide you with the support and tools you need to become a well-rounded MRI technologist by the end of the program. Now I have the honor to introduce our next speaker, Jasmine Davis, who will share her experience as a recent graduate of the MRI program.
Hi, my name is Jasmine Davis, and I am a recent graduate of Johns Hopkins MRI intern program of class of 2025. Today, I'll be sharing my experience over the 6-month program, covering everything from the classroom setting, clinical rotation, and day-to-day workflow, as well as my time working with the incredible MRI team that I learned alongside throughout the program. Before I begin, I would like to give a brief background about myself. I've been X-ray tech for 6 years. I graduated from a hospital program in Washington, D.C. After graduating, I worked at an urgent care outpatient facility as well as a travel tech for 2 years. Actually, that's how I found Johns Hopkins MRI program, by working at their Johns Hopkins Green Springs outpatient location. Once I applied to the program, I was scheduled for an in-person interview where I would speak to a couple MRI staff members. After speaking with them, a couple weeks later, I was given a notice that I was accepted into the incredible program, which I was so happy. Only now is I had to find housing since I lived over an hour and a half away. I actually found housing 2 blocks away from the hospital that also has utility, Wi-Fi, furniture, all included in the base rent, as well free shuttle to get to and from the hospital. My first week, I had to do orientation where I was able to meet management, other MRI techs, as well as receive a tour around the hospital to different departments. The one thing I liked that John Hopkins had their own personal app that you can download and you can put anywhere you want to go in the hospital and you can follow it just like a regular GPS. Next, I had class experience where I can say the instructors are very organized, prepping me for the class and clinical schedules. So I knew what class began, which clinical site I'll be rotating to every 3 weeks throughout the program. They provided all the classroom materials, which I did not have to come out of pocket for any books, which was great. The instructors taught physics, anatomy, and protocol. I would say physics was the hardest thing for me because I struggled to understand the information. So I reached out to the instructor and they had no problems taking time to give me extra help. The instructor also added extra materials such as mock and lab classes, as well a Jeopardy class that we was able to review all the materials throughout the program. For clinicals, I was able to travel not only to the hospital, but as well as to 3 outpatient sites such as Green Springs, White Marsh, and Wild Lake. At the hospital, they do have 1 inpatient and 1 outpatient unit, as well as cardiac and IR/OR unit. For the outpatient, 2 out of 4 were close to me. They was able to drive 20 minutes away, which was Green Spring and White Marsh. Wild Lake was a little struggle due to the traffic, but overall, I had a great experience being there. My experience with all the techs, they are willing to help and assist. They gave me encouragement, they helped build my confidence, they share their wisdom as well. Yes, it was a little difficult learning from multiple techs, but I was able to take things for each one and make it my own. Throughout the program for clinicals, I would have to get 125 exams, which was thought was very hard, but it really wasn't. All the exams that are required for the ART are built into the program and required needed to graduate. For the first week, I was able to follow a tech and learn their ways of learning EPIC, screening the patient, and patient safety. That's the number one thing that we are really big on is screening patients to make sure they're safe because the magnet is always on. The second week, I was able to do my own thing and flow and get my patients and put them in the scanner. And by the third week, I completely felt like I was a tech. For my outpatients pace, it was a little more walkie-talkie, much faster, and a set schedule. Inpatients, they're more critical care who may need to stay in certain medications while being scanned, or patients need to be put to sleep for their exam. For different exams, outpatients was more MSK, such as your foot, ankle, hip, and wrist. They have breast and breast biopsies, as well as special exams such as a fetal, which you're able to scan pregnant women. And I actually was able to scan and see a woman with twins. Inpatient exam, it was more total spine, MRA, which is carotids, your back, which is active stroke patients, a lot of Ps from newborns and teenagers, and a navigation exam where we're able to put fiducials around a patient's forehead who will have surgery to possibly remove a tumor from their brains. Overall, throughout, I was able to meet with the educators that had one-on-one meetings. That's where I was able to check in. They can answer any questions and basically keep an open communication where I felt safe to talk about. I also was able to receive feedbacks from all my rotations if I was doing great or if I need to improve any areas. Overall, felt very supported. I had a lot of resources to be very successful in this program. So I hope my experience give you a clear picture of what to expect from the program and how valuable it can be for your growth in MRI field. I'm happy to answer any questions you may have in the Q&A, and I will pass things back on to Nikki. Thank you.
Thank you, Jasmine. I moved to Baltimore from Pennsylvania when I started my career here at Hopkins years ago. And at that time, I did not know much about Baltimore. I quickly learned that Baltimore has a lot to offer. You can visit the National Aquarium, the Maryland Zoo, Science Center, and a variety of museums. There's Fort McHenry, where you can learn both some history and take in the harbor views. For sports fans, Baltimore is home to the Ravens and Orioles teams and their stadiums. In addition, the city is in close distance to many other metro areas such as New York City, Philadelphia, and Washington, D.C. Just outside of Baltimore, there are mountain trails if you like hiking and rivers where you can do tubing or rafting, and it's just a short 2.5 hours drive to the beach. One great thing to know is as a Johns Hopkins employee, you have access to discounts on attractions and housing. If you are moving here, we can help make recommendations based on your interests. Within Baltimore, there are pockets of neighborhoods that are little communities within the city. Each neighborhood has its own charms, but in every one, they have little different shops, restaurants, and nightlife. When I lived in Fells Point, I enjoyed walking along the water, stopping into a coffee shop, and cruising through the seasonal weekend farmers market. There are other harborside neighborhoods such as Canton, Inner Harbor, and Harbor East. Mount Vernon and Hamden are a few other great neighborhoods to live in as well. Next, Krista is going to speak about the opportunities after the program. Once you complete the MRI program, you will be a full-time MRI technologist at Johns Hopkins. Our senior tech and leadership positions, such as MRI chief tech, MRI coordinator, MRI educator, and MRI manager, are typically hired from within the MRI division. The learning doesn't have to stop once you complete the MRI program. We have a quality improvement program, future leaders program, MRI safety officer committee, MRI comprehensive unit-based safety program, and a tuition reimbursement program, to just name a few opportunities. Our dedicated MRI tech educators continue to support your skill set and growth throughout your career. If you're interested in reading more about the full-time opportunities at Johns Hopkins, you can scan the QR code. So what are the next steps? Well, apply now, of course. You can use the QR code to find additional information on the Johns Hopkins MRI program website. From this page, you can click Submit Your Application to apply for the MRI program.
And now we will move into our Q&A portion of the webinar. Please send your questions into the Q&A box.
So the first question we have is, can I still work full-time or part-time while attending the program?
I can answer that one. So our program, because it's full-time, 40 hours a week, we have found that we have had some technologists try to work a second job, either full-time or part-time, and we found that they do struggle a lot during our program because we are an intense 6-month program. However, we have had technologists that have stayed PRN with with previous jobs, either in X-ray, and they have been successful within our program. So I think it's going to be, individual dependent. That PRN, yes, you can probably do, but I would say full-time or part-time as a second position is probably not going to be wise. But PRN, yeah, it's probably going to be doable. Yes.
Second question is, what does the employee onboarding process look like in terms of support?
I can take this one. So once the program is finished and you are the MRI technologist, we still follow like a 90-day orientation of the employee, where you will be meeting with your supervisors. We go over policies, procedures of Johns Hopkins, and then we assign you to a preceptor. And then one of the educators is also assigned to you as well to be your support. We ensure that you do a clinical competency wherever that you are working to ensure you're ready to go. And then the supervisor does their regular check-ins to make sure of your progress. And then you have employees next to you that also provide the support as you are orienting.
The third question is, in case I miss registration, where can I apply to find out if I am approved or not?
So we have the QR code on our website. You can go to the MRI program website, and on there is where you can apply. It'll link you to the application, and there is no fee to apply. So we just encourage you to go ahead and apply if you have, and our HR and one of the program directors will reach out to you.
Fourth question is, what is the max amount of students you accept into the program?
So we evaluate this each year. Max is probably, I would say, 5 to 8. This recent year, we just graduated 8, which is our largest of the program. Like I mentioned earlier, we like to keep it small, more intimate class sizes. So I would say 5 to 8 is what we typically do.
Perfect. Fifth question is, what made you choose MRI instead of CT while you were in X-ray?
I think that's everybody's personal choice and then what adventure you go through. But for me personally, while I was in X-ray school, they had me rotate through CT and MRI. And during my opportunity with CT, the techs kind of just pushed me aside, like, get your dry brain and dry abdomen and get out of here. But when I went to the MRI rotation, she was so enthusiastic. She actually let me scan an employee. And so I just fell in love with it because of just being given the opportunity and somebody being accepting of me. And of course, I enjoyed seeing the images and everything like that. So it was mostly just having the opportunity.
Great. Are all scanners different at Johns Hopkins?
I can answer that one. So we do have a lot of the same vendor on a majority of our scanners, but we do have 2 different vendors, so you can get a variety of experience in different years. We do have different scanners though, so you're going to learn on 1.5T and 3T scanners. So you get a pretty wide variety of scanner equipment that you get to work on.
Great. Next question is a question for Jasmine. Do a lot of patients get scared by the scanner, and how do you deal with that?
Yes, we do have patients that are scared of the scanner. First, we do like to encourage them and talk to them and tell them how it's important for the scanner. But if they're still scared, maybe we can talk to, if they're inpatient or outpatient, maybe get their providers to prescribe medicine to make them calm down to go through the scan successfully.
Okay, another question we have is, how much travel is required when I'm in the program, and do I have to travel to all different locations that you mentioned?
I can take that one. So travel is evaluated each year. And again, it's based on like our staffing, exam volumes. We don't always use all of our locations. We use sometimes we use all of them. We also take into consideration the home location of where the intern happens to live. We don't want to send them any more than over an hour away. We try to, when we create our clinical rotations, but it's not always a guarantee. I can tell you that the main location where our classes are, and at least multiple of our clinical rotations, the main hub is at the Johns Hopkins Hospital, but it does vary each year of which sites that we use in conjunction with that.
Next question is, what out-of-pocket expenses would I have?
Great question. So currently the out-of-pocket expenses includes the cost of uniforms and parking depending on which clinical site you're at. So at the outpatient imaging sites, the parking is at no cost. And at our Hopkins Hospital campus, there is a cost for parking there, but we can help you kind of walk through that.
Great, I think we got through all the questions unless there are any other things that anyone else is thinking of that we didn't cover today. Great. We thank everyone for joining, and just a reminder, everyone will receive the recording of today's presentation in their email. You should expect that by end of week. So we thank everyone for attending and look forward to hearing from you. Thank you.